Malaysia government has advised the public to carry out self-testing before gathering to avoid spreading the virus. However, some parties have questioned the accuracy of the self-test kit. In this video, we will introduce the advantages and disadvantages of three most commonly used diagnosis methods and how to increase their accuracy. The three most common diagnosis methods for COVID are antibody rapid test, antigen rapid test, and real-time PCR test. The antibody test was commonly used during the early phase of the pandemic in 2020 when the antigen rapid test is not available yet. When a person was infected by the virus, his body will produce antibody M and antibody G to fight the virus. These antibody can be detected in the blood. In other words, if a person has the antibodies in their blood, they are considered COVID positive. This is the procedure.
Kita ambil kurang 10 microlit, 10 microlit tu beberapa titik je lah. Ni small lah. Yang ni kita wait for 15 minutes. Sementara tu boleh buat swab dekat dalam. Okay?
For the test results to be considered valid, the C line must be shown. If that criteria is fulfilled, the appearance of line in G or M will be considered positive. As this method requires blood sample and the accuracy is not much higher than the convenient antigen test, this method has been slowly replaced. The most common self-testing method is the antigen rapid test. The sample used can be saliva or nasal swab. To increase accuracy, nasal swab should be used instead of saliva. Besides, it is very important that we follow the instruction of the manufacturer properly. Many people read the results too early, before the second line could appear. This photo shows the self-test kit results of a COVID-positive patient. The manufacturer advises to wait for a duration of 15 minutes. As many of us have known, the most accurate method to diagnose COVID is via real-time PCR. However, it is also the most expensive and complicated method. Hence, it can only be carried out by professionals in laboratory that contain the real-time PCR machine. The footage shown here are provided by International Medical University, Malaysia, that was providing PCR support during the early phase of the pandemic. First of all, a nasal swab is obtained. Afterwards, we will need to extract RNA by performing cell lysis, nucleic acid binding, washing and nucleic acid elution. The lysis step aims to expose the virus RNA from the human cells. First, the nasal sample from patient is mixed with lysis buffer. Subsequently, virus binding buffer is added and mixed thoroughly by vigorous shaking. After that, the mixture is added into virus binding column as shown here. Next, the mixture is centrifuged. This will pull the buffer down while leaving the nucleic acid in the upper chamber. The subsequent washing and RNA elution step are similar to previous steps, so the process is not shown here. Finally, the real-time PCR mixture is prepared according to this table. The PCR mixture will be processed with the real-time PCR machine. If the PCR test detected viral genes such as E gene, S protein gene or RDRP gene, the patients will be considered positive. Lower CT value indicates higher viral load and thus higher infectivity. If you enjoy the information that we share, please like this video and subscribe to our channel so that you will be notified when our next video is ready. By giving us positive feedback, you will help to promote our videos so that more people will be able to receive correct health-related information. If you are interested in vaccine and infectious diseases, you might be interested to join this short course in immunology and infection. You can complete the course in 3 to 6 months and the course is conducted fully online. For more information, please scan the QR code or refer to the link in description. If you prefer a full master degree instead of short course, you can join this program. You can complete the whole master program in 1 to 2 years via online or mixed modes. For more information, please scan the QR code or refer to the link in description.